I'm Ed Kaine for functionaltherapy.com and functionaltherapyclinic.com, and also Functional Therapy Magazine, and here on YouTube. What we're doing, we're always talking about less pain, more gain. And I've just been banging off a few quick little stories to tell you about how to get yourself out of pain. You're going to be surprised with this one. This has worked with lots of people. I've worked with thousands of people, and getting people out of pain is one of my specialty areas. I'm going to teach you the shoulder clock. Now, you've seen shoulder pendulum exercises and things that help reduce your pain. You're wondering, why does this work? In another video, we talked about the locomotion or the disco move. I'm talking about something to set this bone into place a little bit better. But right now I'm going to, so go ahead and check that out, because that's pretty important to the way your shoulder is going to work. You need to be able to have the shoulder working in place. But now, even if you can't do that, or if you can't move at all, remember these somatic exercises, you can just think them. But again, if you're concerned in any way, check with your physician, check with your therapist, check with anyone you're working with on that level, because obviously someone working with you one-on-one will be able to help you with this more. But these are so simple that often they're fairly safe, but again, I can't be exactly sure about what you're going to do with them. You're going to be able to see me move a little bit to do it, but it doesn't matter. You don't have to do it with any kind of lot of movement or something. In fact, I want you to do less, because all our goal right now is less pain, more gain. You're going to get that shoulder back to at least comfortable, and then every time you're hurting it, every time you're having that pain, you go, oh, what's happening right now? Why is this going on? And can I go back and fix it up? And of course you can. So imagine you have a clock down below your hand here. I'll try to do this so you can kind of see where I am. But the clock then positions would be right straight in front of me is 12 o'clock, right? So that's 12. I'm moving, I'm contracting, and I'm using that do, undo, and pause. Pause is just letting it down. Now, check out the neck moves. If you're real tense up like this, that's not going to be any good for you. Some of these positions that we do as therapists, we test people into impingements of the rotator cuff, things like that. But if you're already set in like that, or even if you can't do it, or say you've just come out of surgery and all you do is think, 12 o'clock, relax. And you go, what? That feels better. What? I'm going to do the clock moves, and we could either do all 12 clock positions, or you can maybe find the ones that are most important to you, because remember, you're looking at me like that, so your clock is going to set you to go up and to the side like that, which would be 130, wouldn't it? If it was your right arm going up to the side. So here I am. Do, undo, pause. There's 130. Do, undo, pause. Kind of keep my thumb kind of still aligned that way, but I can sometimes rotate it or whatever, doesn't matter. 3 o'clock. You see how I'm kind of like bent into this? I can be in different positions where I'm in more of a pendulum position. You might be taking a whole bunch of morphine and be in all this pain for days and days, or you might just do this and just reduce your pain. I'm giving away all our secrets here. It's okay. You can help yourself out of pain. Pain's not helping you that much, other than keeping you from doing things that are harmful to you. So you've seen I'm going do, undo, and pause. That was 9 o'clock for me, because I'm working on my right arm going out to that part of the clock, 10:30. And you can go a little bit. Now, let's say you go out to one direction. You go, oh, wow, if I do a 4:30, that's my sore one. Well, you might do 4 o'clock. Oh, that's so sore, right? So then 4:30, 5 o'clock. Now, you don't have to move. In fact, you might be in a post-surgical thing, and they don't want you to move at all. So you don't have to move. Don't move. You're just going to do 4, and I just did it. I did 4 o'clock. I'm going out to the side like that. Even though I haven't moved, or you can tell I haven't moved, but my muscles tensed up just a little bit. Move that out. My friend Ed Barrera says, getting out of pain is easy. You just contract the muscle and you relax the muscles. The pain's gone. When I learned that, I had been in chronic pain for 2 years in my hamstring. I just did it. My pain was gone. I was like, what? That's so great. So sometimes you're getting out of that. Sometimes it's real simple and sometimes it's not. So don't get discouraged if you don't get an instant relief. But this is the shoulder clock. So you're just doing your shoulder clocks. Shoulder clock somatics might be more accurate if you're really talking to different people, because different people are like, just get that really swinging. It's like, that might do some damage. Passive movement might. I mean, it might not, right? So if you're fine with doing things and they don't cause extra pain and the pain goes away, typically that's helpful. If you're on a bunch of heavy-duty pain medications, anti-inflammatories, and you're doing all this stuff, that might not be as good, right? Because I'd rather, use the pain medications to reduce your pain, but then try to get yourself out of that state where you need that. That's my opinion. Obviously, check with your physician, check with your therapist, body worker before you get doing anything that you're concerned about. Again, you can do this without even moving. Say I'm going to sling and I just move back to 6 o'clock and do it like that. And then suddenly your pain's gone and everybody's wondering, where'd you learn that? You learned it here at functionaltherapy.com or on YouTube at the Functional Therapy Magazine. And my name's Ed Kaine. I'm at the Functional Therapy Clinic here in Connecticut, so there's probably someone in your area that would be able to interpret what I'm talking about here and help you out with that if you're in a different area. But at any rate, good luck with whatever's going on for you. Share this with your friends so they don't have to go through all this shoulder pain or any pains. You'll see a bunch of different videos we have here on getting out of pain, because less pain, more gain. Check out if you're got stuff with your back, the pelvic pore video, what does brownie have to do with pain, all those different things we've done today. So check it all out, and we'll see you soon. Thanks so much.